The Vibe at Vive is sponsored video content brought to you by MedCity News.
Hi there, I'm Katie Adams with MedCity News, and I'm here with John Petito, Chief Strategy Officer at TailorCare, which is a company focused on musculoskeletal.
Thanks for having me.
Yeah, thanks for being here. I would love to start off by having you explain why TailorCare's approach is unique and why it might be different to other companies that focus on improving patient outcomes for MSK patients.
So I think a couple things come to mind. First and foremost, we are the only specialty value-based care organization that takes full risk. So we align the incentives by partnering with plans, risk-bearing provider groups, and because we have taken the full population level risk, upside, downside, we start with the patient. What is the right course of action, the right kind of care for them? So I think a lot of other organizations may have specific incentives that are driving them to drive down type of care, drive up type of care. For us, it starts with the patient because of that.
So I know that you take a deeply personal and a data-driven approach to improving patient outcomes. So can you explain where your company sources its data, how that data is analyzed, and then why those kind of processes are so important to the future of personalized care?
Yeah, it's a great question. Data is core to what we do. So we are about creating a great experience. We have a plus 90 NPS for patients since we've been live and partnered with our customers. Experience, engagement, and data. And data in the sense of what is the right answer for the patient, i.e. what is the right care pathway they should be on. But then once we've identified the right care pathway, it's about getting them to the right provider that they have access to in their network. And so it's both data about the patient that we're collecting and generating as we're engaging with the patient upstream. It's data about the network and the benefits they have access to. And then how we then fuse that data back to effectively inform what is the right care that we're personalizing on an N of 1 for a given patient when we're engaging with them in that exact moment where we're trying to help them identify what is the right care for them, which is the right provider, and then actually getting them there and navigating them to the right care for them.
Interesting. That leads me to wonder if you can share any insights on how your company partners with providers and health plans to reduce costs and create that more seamless experience for patients.
Yeah, so like I mentioned before, we take full risk, so we partner with risk-bearing providers, we partner with health plans. We effectively staff a team of licensed doctors of physical therapy. They are doing intake with patients, so as far upstream as possible to identify the needs of the patient when we know that they have an MSK need of some sort. We go build relationships with network providers, so in the market, the care delivery system that the patient is going to receive care from, we're building relationships with them. And then we effectively identify patients. We've got a predictive model, so we're effectively taking in information, looking for the patients that are highest risk. We build referral relationships with providers. Once we partner with them, patient comes, we do a detailed intake to understand what are their clinical needs, what are their preferences, what are their goals for care, get them on the right care pathway through shared decision making. And then, as I was mentioning before, using data about the network, who is the highest quality, highest value provider they have access to, then helping them get that care. So in some cases, we're actually scheduling the appointment for the patient and sharing information back and forth between what we've collected and garnered from the patient as well as what the provider is collecting.